surprise. I was intending to videotape a lot of information of me coming into hospital, leading up to it. I was going to get my husband to videotape stuff, but we had a big surprise because we got called in 2 weeks early to, if I could get to the hospital by 2 o'clock, I could be operated on that day, and that was yesterday. As you know, for those with C.A.A., we're not allowed to take blood thinners, and you may also know that giving blood thinners is a big thing in most procedures retaining to blood thin hip. And you got to bear with me, I'm a bit fuzzy, and so my memory's a bit bad, so we'll just go as we go along. So I got to the hospital about 2 o'clock and did the usual procedure, check-ins. I had an ECG, I had blood tests. I'd already gone through in my previous videos what I went through. There'd been a discussion with my neurologist and my hip surgeon about blood thinners and how we could and what we should do regarding that. I'm not going to go into detail of what was decided because, as we always say,
feeling okay?
I'm feeling good, thank you. So as we always say, it's our journey. You have to make your own research and ask your own doctors about surgery or anything, because, you know, I don't want to give out any information that's incorrect. I'm not a doctor, I'm not a medical practitioner, so you have to remember to do all your own research. Now, because we opted that I was going to have blood thinners, and again, I'm not going to go out in detail, but it did make it, the after surgery, a little bit more difficult. I also have some allergies to other painkillers, so it's been a little bit complicated. Just stop that now. We'll start again. Okay, so the surgery went fine. I'm under a great team. The team consists of the surgeon, the anaesthetist, a doctor, a physiotherapist, a limousine service. It's a great a big catalogue of things that I'm into. And here in Australia, I have private health insurance, and usually there's a gap between what the health insurance would pay and what they can recover.
It's just your 2 Panadols.
Thank you. But so after the surgery, obviously you're in recovery for a while. That seemed to go all right. I went back to my room, and
I'll be right back.
the main problem I had then was, you know, you're laying on your bed, your legs are parted a certain distance so that you can't be tempted to roll over, cross your legs, cross your hips. But I also have spinal problems, and I found that was my biggest issue. I couldn't roll over, and I had a lot of pain from that, and I had a shocking night. Woke my husband up at 2:30 in the morning, having a cry, you know how that goes. And then the next day, they wanted to get me out of bed, and the next day is actually today. And I was in so much pain and lightheaded and lost my colour when I tried to get up that we, for that little session there, we decided to abandon it. But I'd been laying down flat for like 24 hours or whatever, so it kind of was to be expected. Cut. Now, I've watched a lot of videos about hip replacement, and they usually heavily, you're heavily given concoctions, you heavily got painkillers on board, and that just wasn't available to me because of having C.A.A, blood thinners. I had quite a few allergies, and so I struggled, and it took a lot out of me. So I was, as I said, I had all good intentions of videotaping all the way along. However, I really don't think that you should be seeing that of what I went through. I don't want to scare you, but knowledge, it's good to have knowledge. And but I looked a lot at videos, and it was the happy ending, and I've just not found that. However, it is now 6:30 at night. They've got me out of bed again. This was more successful, and they put me on a commode chair and took me to the bathroom, and now I'm sitting in a chair. So I've come a long way just from this morning, so I'm happy with that. That's about all I'm actually going to take right now. If anything progresses, I think I'm going to be in a little bit longer than what we thought, and that's understandable. So I'll just cut it off for now, because I'm going to probably put this whole journey into the one video, so we just goes as we come. I'm comforting right now with my husband. Thank God for him. It's been a godsend. And that was one of the nurses coming in to give me some Panadol, because I've got a headache, and I really think I think that is a tension headache, because I've gone through a lot in the last 2 days. I like to plan, and I went from having a plan to suddenly waking up with a phone call, come get it right now. So everything sort of was very stressful for me in those first few hours. One good thing, when I did book in and they took my blood pressure, it was 118/75. Is that what I told you? Yeah, 118/75. And that's really good. They're happy with that, and I'm happy with that. All right, so keep logging on, keep staying tuned, and we'll walk you through this. I didn't tape me getting off the bed just now, which I really should have, but I was busting to go to the toilet, so it was like, let's just do this. Okay guys, I'll see you in the next video. Thank you. It's 4 a.m. and what a change from the last couple of days. I've just been woken up. I'm having all sorts of tests still, because I'm taking all sorts of things that I think perhaps could affect my C.A.A. I've lost track really, but so I get woken up every 4 hours to do all sorts of tests, and because I don't get the urge till the last minute that I want to pee. My nurse said, did I want to get up and go to the toilet? And I'm like, no, let me sleep. And he said, no, it's been a long time since you peed. Let's try. So I got out of bed, onto a commode. It's difficult because my leg still hurts. I think it's the muscle part of it that's hurting, and they either cut the muscle or they move it around or something to get where they want to go. And it's sat on the commode, and it was only a little bit of grizzling and because it hurts. And then into the commode, onto the commode, into the bathroom, did what I had to do, and back out and back onto the bed, and that's a little bit difficult as well, because as I say, I'm not used to the walker, because you have to get out of bed onto a walker, two-wheeled walker, and he right now I can't actually lift my leg while I'm flat on the bed, so that's where you can either get someone to help you get out of bed with your leg, guide your leg, or you can use a leg lifter, which is like a strap and it goes around your toes or your bottom of your foot, and you can lift it up. And I've got a leather one, and it's at home, and they've given me a rubber one here, which I find it's not very good. It's probably cheap, that's why they do it. And so onto the bed, guide my leg onto the bed, and I use my good leg to shift my body up to the top of the bed, and that's all good. I've switched sides of the bed from what I usually sleep at home, because my dogs sleep beside me, and that would be a nightmare having to try to get out of bed where they are. So when I go home, I'll be switching sides. I feel a lot different today, even mindset. I had a bad night on the first night. It just, my back, it wasn't even the pain. The pain they managed. It took a bit of a while because I'm not on the painkillers they would have wanted to put me on, because of I do have C.A.A. So even with the ice packs, we sort of got that under control, but it was my back. Because you lay down, you're on the bed, lay down almost flat on the bed, and you've got like a wedge or a pillow beside your two legs, because you're not allowed to cross them over, not even cross at the ankles, nothing. And I couldn't move, I couldn't shift, I wasn't allowed to roll over, and my back. I was so distraught. I really was. I didn't want to film any of that. I didn't want you guys to see that. I was distraught, crying. I rang my husband up 2 o'clock in the morning, crying, and he was trying to calm me down. And oh my gosh, I was going manic, because I knew the only way I could stop that pain, because the painkillers they were giving me were targeted at that part of the body, not my back. And I knew the only way I can stop that pain was to get out of bed. And I knew that I couldn't just get up and get out of bed. That would have wrecked everything. I would have wrecked my hip. Just everything I'd just gone through would be all for nothing. And I just, I had to lay there, and I knew I could see the bloody clock, and the nurse kept coming in saying, "You really have to go to sleep." Really, and I couldn't go to sleep. And I can't think of any other word but manic. And I regretted even having it. Just everything. I've got a different mindset now. I know it's going to be good. I think normally when I have an operation, I bounce out of bed. I get to go into the toilet by myself as quick as I can, showering by myself as quick as I can, walking around as quick as I can, because I know that they're the things that they want to see you being able to do before you can get out, go home. So, but it didn't work this way. And I watched so many videos about hip replacements, and they're usually walking on the first day. Well, they're full of drugs, and they're full of drugs that I can't have. So the only one, I've got allergies to codeine, oxycodone, and to fentanyl. And they've put me on tramadol, which is what I was on. And it hasn't got blood thinning products in it. And they've boosted it up from what I was having. So they knew I was going to be sort of safe on that. So that first night, it was tragic, and I intended to try to tape every minute that I was in here, let you see what it's really like. And so I didn't for that night, because I thought, this is not fair to show somebody this, because as I keep telling you, that's my story. It's not your story. For you, it might be different. For you as a hip patient without C.A.A. Now, C.A.A., if you don't know, if you've clicked on this link for a hip replacement, I have got C.A.A., which is Cerebral Amyloid Angiopathy. And it's a brain disease. There is no cure. There is an end. There's no cure. And I can't take blood thinners. Now, most operations with having a hip replacement is they give you blood thinners. If I take blood thinners, there is a risk I will have a massive hemorrhage. And so we had to weigh up all that. And my hip story is going to be slightly different for you if you don't have any problems taking blood thinners. So as I always say, I'm not a doctor, and I need you to see your doctor and fully understand any condition you've got and how that will relate to you. But you don't do what I'm saying, you check it out for yourself. That's very, very important, especially if you've got C.A.A. as well. Okay, so I want to go back to bed now. I want to go back to sleep now because I was opened up. I was woken up at 4 o'clock, and it's 5:30 now. And but it's still a couple of hours, so I want to just get a little bit, because the night before, the first night, I didn't get any sleep. I probably got 2 hours broken up over the night. And when the physio came in yesterday, she showed me another position I could get in that might relieve my pain of my back, and my goodness, it did. She came in. What time did she come in? Oh, well, my son was visiting, so it must have been 3:30. Physio come in, showed me another way I could sleep slightly different, slightly off my back, relieve that pressure. And once my son had gone, I just dozed off to sleep till my husband got there, and then I've slept all night. I woke up once before because he had to come in. The nurse had to come in and take my vitals again, and because they're giving me some other drugs as well. They've just started on the low dose aspirin now that I'm going to take for 6 weeks, and got a dry lip. So they're testing blood sugar levels, my pupils, because my pupils don't dilate, so they keep an eye on that in case suddenly they start dilating, because that could be a problem. Something could be going wrong. And so yeah, I don't know what time that was. He came on, and then I would say every 4-6 hours. I'm not sure. I think I was asleep by 9 o'clock last night, so that was good. All right, I think that's all for now. I'm going to go to sleep, and actually, I think I'm going to need to go to the toilet again. See, I can't feel it at the moment, and so it is a bit awkward, because by the time I feel it, I'm almost peeing myself. So that's, anyway, we'll get through that. And that could still be because I've got a small amount of epidural, because I had epidural in my back as well. All right, ladies and gentlemen, have a great day. I think I'm going to have a great day today. I hope I've lost a few kilos, because I've basically not been able to eat because the position you're in, and half the time I had a drip in my arm, and there was putting medication, like what do you call them, antibiotics in, and then fluid in, that I really couldn't sit up properly to eat my food. So, of course, you go for the dessert. If you can't eat the schnitzel, go for the dessert. Okay, so I'll see you in the next part of the video. Now, I might just get you to hold this so that when I get up, I don't.
How are you feeling?
Yeah, all right.
We'll let go?
Yep, so I'm backing around to that. Is that what we want to do? Yeah, that's too low.
You can just kind of walk there.
Yeah, and you'll come behind me?
Yeah.
Right. So you just move around this bed so you can see it there?
We sat on the commode either way, didn't we, last
Yeah,
time?
because that toilet's too low. Yeah. And see, this morning when I did it with you, it was the first time I think I walked in here.
Okay.
So
So I'll just put it behind you when you kind of get a bit more in there.
oh yeah, we put it over the toilet first, didn't we?
Yep, we did. If you found that,
Yeah, that was easy.
cool, we'll do that.
Because I just went past it a bit, didn't I?
Yep. Doing all right?
Yeah.
Good. Okay, yeah. I'm just going to put it on.
Yeah. time because
Yep.
I'm not
Thank
going
you.
to go to the other toilet as well. So. Practiced going backwards yesterday.
So will you give your hand with your,
Oh, yes.
that's fine.
Somewhat. Thank you.
You're welcome. Have a feel for the bar on this side. Yep.
I'll tell you what I'm actually going to do.
Mhm.
Put it down because it gets stuck on here, the skin.
Oh, okay, no worries.
So, yeah, just leave it, I'll pull it up.
Okay,
I'll sit there.
perfect. Cool.
Just pull it up a little bit.
Fair enough?
Yeah.
Okay,
Because
cool.
what was happening was my bum was squishing through and then sticking to the middle. And what she did was she got that bucket.
Oh, that's right, I remember, yep.
Yeah, and that just cooked with this leg. Lovely.
Cool.
Right.
All right, when you're ready, you know the little green button.
No worries,
Goodbye.
thank you. You can cut now, darling. Actually, I think I was trying to push this out too far as well. You know, the actual frame. So smaller steps is easy for me.
Is that bed
Yeah.
low enough for you?
It's been alright.
It should be kind of knee high.
Yeah, I don't know, because I've never changed it. I think it's alright.
It looks.
I think it is, because I
Yeah.
think my legs like go over it. I think any higher might be a problem.
So we're going to reverse, and then I'll help you with your legs. Cool.
Reverse this way. Is this what we're doing?
Yep, if you kind of come this way and then with your,
This is why I don't drive anymore.
you can go this way, either way is fine. As long as we get your bottom to the side of the bed. But try to sit up a little bit more
Yes.
up higher, otherwise you'll be kind of punched down to the bottom. That's it.
Yeah, that's what was going on the first time, because my feet were scrunched up against the bottom, because I wasn't sitting up high.
Kind of feel the bed with your legs. Yep, that's good. Just sit down.
I don't want to sit on that.
No. Yep.
Got an ice pack for you too. Sit back a bit further.
Yeah.
Then they have given you a hooky thing to your legs, isn't it? Sorry. Try using that hooky bit.
Oh, what's that?
So this is just from the physio. It's easier to lift the leg.
I've actually got a leather one at home which spreads. And it's,
Okay.
this one tends to stretch bits.
All right.
So, but it's good while this is here.
Okay. Sit back a bit further.
Yeah. Can you just hold that one?
Yeah, sure. Thank you. That's better. Okay.
She does it herself or?
Yeah, I've got to do it at home, so
Okay, sure, of course.
I appreciate all the offers.
I think if you can do it yourself, it's probably the best.
And at home as well. And my husband grabs it and puts it up because it's the same at home.
That's gone up. Yeah. That's good. That's better.
Did it?
Good. Ice pack.
Good job.
Okay. Do you want some tramadol?
Yes, my 4 hours or whatever.
Not one.
Like,
Just wrap it around.
oh, it's just
blood
air in
flow.
there, is it?
Yeah. And you just have to turn it on. That's it.
There's a bottom top, that's right.
Yeah.
And this is you know what these are for.
So you don't get
Circulate. Blockage.
white clot.
Yes.
Okay.
Can you also just push me up a little tiny bit on the bed? Bring me
You
back
need
up.
to back up? Yes,
Yes.
sure. There we go. Don't want to stop you.
one pillow up. So it's called the second one, yeah. Good lad. Oh, sorry, I call me good lad. That's what I call my
That's fine. It's all good. You comfy?
Yes.
Great.
Actually, can you just bring that leg over for me a little bit more? Just a bit more. Yeah.
Yep.
And then turn on the pumps. Oh, they are turned on.
They're to be turned on. Yep.
Yeah. Lovely, thank you.
Take care. You gonna be in tomorrow? Or
I'm supposed to be going out maybe lunchtime, but in the morning.
tomorrow lunchtime?
Yeah.
I'll see. Oh no, I won't see you tomorrow. All the best. Nice to
Alright,
meet you.
same to you. Nice to meet you.